WA has had another increase in daily COVID cases, with 8,144 new infections. And the fall below 40,000 total infections in the state did not last long, with 539 active cases now across WA. There were two more historical dating back to April 2nd. They were women aged in their 90s and 60s. There were 200 people with COVID-19 in hospital and 5 in ICU to 8 p.m. on Wednesday. Of the 8,144 cases, 3,373 were confirmed via PCR test, with the remaining 4,771 were self-reported positive rapid antigen tests. A total 12,690 PCR tests were conducted at either state-run or private pathology clinics on Wednesday. Your cookie settings are preventing this third-party content from displaying. If you'd like to view this content, please adjust your cookie settings. To find out more about how we use cookies, please see our cookie guide. The latest figures come after WA recorded 7,426 cases on Wednesday, with total case numbers falling to 39,591. A twice-weekly snapshot published by WA Health shows the cumulative numbers of COVID cases diagnosed to the week ending April 10th was 251,403, just above the lowest level forecast by the agency's Omicron modeling. However, the number of hospitalizations was far below the predicted range of 1,827 to 2,834. And number of patients requiring intensive care, just 28, was also way less than the 198 to 327 contained in the modeling. A breakdown of COVID hospitalizations between March 28 and April 10 showed the unvaccinated were still disproportionately represented, accounting for 28% of all hospital patients despite comprising less than 2% of WA's population. People with just one dose made up 5% of hospitalizations, 2 doses comprised 30% of hospital patients, and the remaining 37% had been boosted. Importantly, WA Health does not distinguish between people in hospital because of COVID and those receiving treatment for other reasons, such as a car accident or broken leg, who are subsequently found to also have the virus. Children under 10 continue to account for more than 1 in 10 COVID hospitalizations, but the biggest age group was 50 to 59-year-olds, followed by people aged 60 to 69 and 70 to 79 and 40 to 49-year-olds.